formed the world with love. He fashioned careful principles to ensure that his children would live in a just and peaceful society. Violation of his ways has summoned up the shouts of war and the cries of starving children. Where can we find answers? God's word is still available to guide humanity. The book of Deuteronomy reveals a specific template, clear principles upon which to build a godly society. Justice for as many as possible, the extension of mercy and salvation, a secure environment in which to nurture future generations, the upgrading of living standards, the wonder of discovery, the blessing of entertainment and pleasure, the necessity of learning, the right to make informed choices. These domains of society represent God's blueprint for a healthy nation. But who will teach the nation his ways? It will take people of vision and courage, who not only know their God, but also their business, whether that be entertaining a crowd, teaching a new generation, or ruling a nation. Fueled by the firm belief that God was calling Christians to become involved in governing the new South Africa, the African Christian Democratic Party was formed. And in the historic elections of 1994, went on to win 2 national and 3 provincial parliamentary seats.
My name is Wesley Douglas, and I'm the project director in the city of Cape Town for HIV/AIDS, substance abuse, and street people diversionary programs. These 3 were identified after extensive needs analysis in the city to determine what would be some of the major issues that we are facing and challenges we are facing as a city with regards to young people and youth. We find ourselves under an onslaught of substance abuse, especially methamphetamine, or TIC as it is locally referred to, which has impacted our community in such a way that it's destroying a large number of young people on a day-to-day basis. Previously, we were looking at only 5 or 6% of all substance abuse related cases in Cape Town being methamphetamine, and now at the moment we're looking at 78%, and we're looking at large numbers of young people because it's being sold very, very cheaply. I'm going to focus on each and every one of the programs and projects on an individual basis, and I'd like to begin with our AIDS and HIV/AIDS Orphans project. The project came about in a response as the city of Cape Town to the large numbers of HIV/AIDS deaths that are being predicted by the Medical Research Council in Cape Town in South Africa. We find ourselves at a pinnacle where we have to do something before a tidal wave hits us. In the African continent, we have over 52 million orphans. Many of them were caused through war, many of them were caused through famine, and many of them, or most of them, are caused through HIV/AIDS. And we in the city of Cape Town do not have a problem with war or with famine, but we do have a problem with HIV/AIDS and its impact on the society through the death of our people, but also through the after effect of orphans that are being left behind. The city of Cape Town, we are looking in not only the city of Cape Town but in South Africa, we are looking at over 5 million deaths by 2010 between 2010 and 2014, and we're looking at 1 in 5 in terms of our ratios. At the moment, we have over 200,000 orphans throughout the country, and 40 to 60,000 of those orphans are in the city of Cape Town. At the moment, we are trying our best in terms of helping these children in the situation where they find themselves, being left behind in informal settlements or in shanty towns, as you would know them. And many of them are now being looked over by older siblings or by extended family networks. At the moment, we have a problem in the African society where the extended family networks are being broken down because there's been such a big move from the rural areas to the urban areas that those family ties have been severed. And when parents pass away, there is nobody to look after the kids from the extended family because they're so isolated from their family. And many of them have to travel great distances. And when these parents die from HIV/AIDS, these children are left alone in their shack, and they have to fend for themselves. Many of those children, unfortunately, turn to sex work. Many of them turn to gangsterism. Many of them turn to crime, which is not just a problem to society, but it's a lifestyle that I wouldn't want for any child. And that is the view of the city of Cape Town. We really are taking the challenge to heart, and we're working with other civil society organizations and other levels of government to try and come up with the best program for these children. What we're doing is groundbreaking work because we're looking at mass absorption of AIDS orphans on a large scale over the next 3 years. We've projected in the city of Cape Town that we're going to have between 300,000 to 500,000 orphans by 2010, which is a large number of people, of young children that we have to look after. And in order to us to effectively address that, we have to put all the correct elements in place. We have to have a good area where we can absorb these children on a mass scale, but we don't want to turn to institutionalization as a primary method of care or residence for these children. We don't want a situation where 500 to 1,000 children in an orphanage where there's only a couple of adults supervising them, because then it's not conducive to early childhood development and growth to become model citizens and the leaders of tomorrow. We believe that the most vulnerable should become the leaders of tomorrow, and in order to do that, we need to really invest in them. We need to invest time, we need to invest effort, we need to invest care. And we are partnering with civil society as government to ensure that that process takes place. We're beginning by fast-tracking applications of organizations for state-owned land. We are beginning by resourcing those organizations. In the immediate term, we are providing help for these children by providing them blankets and food and clothes within their current facilities, but the idea is to try and create facilities on a large scale that is big enough and can accommodate these children on a permanent basis. We cannot leave them in their current situation because that's not conducive to their upbringing. Many of them have left schools, many of them have left, fallen out of the social circles, and this is not conducive to the future of South Africa or of Cape Town. The City of Cape Town's program is designed in such a way that we can take a large number of children in an urban setting. What we've done is we've formulated and we have transformed old shipping containers into first world living conditions, where we have air conditioning, we have carpets, we have windows, etc. on the shipping containers, but they are mobile by nature. We place the